I knew I wanted to have a career helping people and something medical. And actually, a friend of mine was going to be, it was our junior year in high school, making a trip down to Parkview Methodist School of Nursing and to check it out. And I went there with her, and I really loved it. And I thought, you know what, I think this is maybe what I want to do. And so I did, and I'm really glad that I did.
I didn't want to be a nurse. There was this little voice that just kept pushing me, and I was like, no. But I just kept, there was this pressure that I should do this and I should do this. And so finally, I kind of gave into it, and I was like, well, I'll sign up for classes at IPFW. Then when I got out and got into the emergency room first, I was like, oh, no, I like this best of all. And then the whole nurse midwife dream went away, and now I just do ER, and it's probably all I'd ever want to do. I can't see myself really doing anything else that compares to it. So
I had grandparents, I had multiple grandparents that suffered from multiple different medical conditions, and going in and seeing the nurses take care of my grandpa who had suffered a stroke really like kind of ignited a passion within me that I was like, I want to be her. Because that nurse not only took care of like my grandpa, but he also took care of our family like during one of our most challenging times, and I wanted to be that person. And then my grandma also suffered from dementia, and just seeing how the nurses cared for her and how they took care of us, again, just really resonated with me and drove it home for me that I want to do that. I want to be that person for someone, and that person for someone's family.
You think you know a lot when you get out of school, and especially when you had worked as a student nurse, so you felt pretty comfortable. And I look back at that time and I realize how much I really didn't know.
And then you realize you just know the tiniest fraction of what you need to know. And even now, like, I know what I need to know for ER nursing. I don't know anything about ICU. I don't know anything about dialysis. I don't know anything about and there's nursing jobs that are out there that we don't even know exist. And there's something for everybody. If you think you don't like one thing, there are a million other things out there to do. So that's pretty cool.
I had a very good foundation to learn from. I had nurses that had been nurses for a long time, and that was one of the main reasons I stayed at Noble, is because I was grounded on a bed of really good nurses that helped train me.
I think for me, it was just really learning to listen to people and listening to what they're, not just what they're saying, but what they're not saying. Because I think a lot of times we're so busy as nurses, we walk into patients' rooms, we have a set of tasks we have to get done, assessments we have to get done, meds we have to pass. You know, you're really, really busy. In the ED especially, you're trying to get through the triage with them, and you've got so many other patients out there waiting to come back. And so you feel like you need to move quickly, but if you really don't take the time to listen what they're saying to you, you're going to miss a lot, and you're going to miss a lot of needs that need to be met. You are on the move your entire 12-hour shift, and
we're tenacious.
Yeah, and I'm sure the doctors a lot of times, because we're constantly up in their faces telling them this and this and this, they're probably like,
we drive them crazy.
Yeah. I'm sure they're thinking, just leave me alone for 2 seconds, let me have a thought of my own.
As nurses, we're super hard on ourselves because we want to be that awesome nurse. We want to be that, you know, I've been doing this a million years, I know what this is before the doctor does, I'm going to get this taken care of kind of thing. A lot of times we do, and then when you don't, then you're just going to be like, nope, I don't. So now I'm the worst nurse ever. Yeah. When you're not. You're just a normal human being that does awesome on most days, but there's going to be times. And then that's when you learn, and you're like, okay, next time, I'm not going to make that mistake. I'm going to take this and go with it. And those are the lessons that stick with you, is when you mess things up.
Besides trying to learn everything about the ED, which I didn't know, and all the new things I had never done before, just dealing with COVID on top of it, I think really escalated probably my anxiety, and even I think everybody's anxiety around me.
What people don't realize is, for nurses and hospitals in general, like, COVID hit us just as out of the blue as anybody else, and we didn't have protocols for this, and we didn't have enough PPE. It was kind of like they threw everything out the window. Everything you've learned and been taught your whole life is gonna change, and you have to do everything different now.
And it's kind of been like a roller coaster. Like it first started and the hype was like up really high and we're like, okay, like everybody get ready, brace yourself. And then we braced ourselves and we're like, okay, this is like not too bad. And then it got bad around Christmas and Thanksgiving and we're like, okay, this is too much. And then it kind of like went back down and now we're just kind of like coasting, I feel like, because we got a good handle on it.
Well, and I even felt guilty for getting it.
Yeah,
you know,
I did
even
too.
because I was doing everything I could not to
Right,
get it.
right,
you know,
right.
at work, and then you still did get it, and it's
Yeah.
and yeah, so you felt guilty then for having to be off for 2 weeks while everybody else is still at work dealing with it. Home life changed because of it.
Yeah.
I mean, when I left work, I mean, you went home. I stripped down in the garage. You know, you took your clothes off in the garage, everything went directly into the washing machine. I wasn't allowed to see my grandchildren because I was a nurse and they were so afraid, you know, that something was going to happen and they would catch it, and my children. So, I mean, it was, you know, I think it was 8 months before I got to actually see anybody. So, I mean, everything changed, you know, because of the fact that we're nurses and that we were exposed to it and that type of thing, so.
I would tell a new nurse starting out to protect two things: protect your back and protect your mental health. So most of us are going to be in this for the long haul. We're going to be doing this for a while. And people expect us to pick them up and move them around. And sometimes we have to. So use your resources, know your resources, get people to help you, use your AirPal, do all of those things, because you hurt your back and that's lifelong. So protect your back and protect your mental health. This year has been so crazy. Take care of yourself, get therapy. Everybody needs therapy. We definitely need therapy. So talk to somebody. EAP is free. PPE Project is free. Go get help, talk to somebody. You would be shocked. And it just seems like the simplest things of just talking about life and what happens at work and whatever. And you feel so much better and you're like, well, that was super easy. Why didn't I think of that before?
I think my piece of advice to a new nurse that straight out of school, starting first day, I would say it's okay to be scared. If you weren't scared, I would probably be scared. And then two, like, let the challenges come because you're gonna learn a lot from it, and be okay with feeling unsure because that's where you're gonna learn, because you're gonna ask questions.